Hello, it's Dr. Rod Story at www.blogging-md.com. Thank you for returning to our website. This is the fourth in a video series on influenza vaccine. Let me launch right in. Today I'd like to talk about the influenza vaccine and its risks and its benefits, and just kind of give you information so you can use it to make an informed decision for your family. Let me launch off first by saying that the influenza virus is coming. We think it's going to be an early season, so I'd encourage you to make a decision if you're going to soon. It takes about 2 weeks for the influenza vaccine to be fully effective in your immune system before it begins to circulate and make people ill. Why the vaccine? Well, just a reminder, influenza is a lousy illness. It's really a knockdown, drag-out chest cold. It lasts 7 to 10 days, causes quite a bit of missed work and school. Even more so, it causes a lot of illness in the United States and worldwide. On a bad year, 30 to 50,000 people actually die of influenza-related illnesses, including in 2012, where 176 children died of the flu-related illness. This is not a run-of-the-mill chest cold. It really does have significant consequences. Most of the time, it's the one-two punch of influenza, the pneumonia that comes on the heels, that actually causes the illness. And every year, pneumonia on the end of an influenza season contributes significantly to the number of people that pass away. It's the 8th leading cause of death in the United States. Pneumonia and influenza contributes quite a bit. Many people consider just waiting for the influenza illness and maybe taking an antiviral medication if it were to come along. I would tell you that the influenza antivirus medications really do very little to reduce the severity and the length of the illness, and honestly are not really worthwhile. Why is there so much concern about the influenza vaccine? Well, I think there's a couple of things out there that people are aware of. I would encourage you to make sure you fully investigate them for yourself so you can understand why. First off, there's a concern that the influenza virus actually just doesn't do much good. There is some reason to think that. Some seasons, the influenza vaccine is not matched well to the actual virus that's circulating, and so it really doesn't do much good. Thankfully, this year it is actually a perfect match for both strains that are circulating. The second is that there are many individuals for whom the influenza vaccine just doesn't take in their immune system. It just doesn't respond, and so getting the flu vaccine doesn't really reduce the severity for those individuals. Interestingly enough, that tends to be the most vulnerable populations: patients who have immune deficiencies, patients who are pregnant, who are young, who are older than 65. Their bodies just don't respond to the influenza vaccine as well as it does in younger people, and that for many people they see that as a reason to not have the influenza vaccine. I would actually make a case a little bit later for why that is actually quite the opposite. There's a couple of other reasons, and I'll address them kind of briefly and kind of give you just raw data and let you think about it. There is a concern that the influenza virus that's contained in the flu vaccine will make you ill, and so it's like getting the illness twice. Understanding this from a science standpoint, I'm not quite sure why this understanding is in the community. First off, what's in the vaccine is not the virus, it's the protein coat, meaning it doesn't have any of the necessary components for the virus to replicate itself. So when you get the vaccine, what you're really seeing is an immune response to the protein coat so that your body can be ready to see the virus when it comes for real. You should have a response, meaning when you get the flu shot in your shoulder, you should feel some pain for a couple of days. You should feel a little bit run down, a little bit under the weather. You might even have a little runny nose or congestion. That's your immune system revving up. That's appropriate. You should have that. You might even have a little low-grade fever. Now, that's certainly not as bad as the 7 to 10 day influenza and the knockdown drag-out that it is. Sadly enough, and I think this is a real risk and needs to be weighed and needs to be talked about, some people do have a severe allergic reaction to the influenza vaccine. We call that anaphylaxis. That's just where your immune system is so overwhelmed that your body shuts down. Thankfully, it's an extremely rare. They did a good survey about 3-4 years ago, and they found that on average it's about 1 to 2 per million people that receive the influenza vaccine have an anaphylactic reaction.